Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Carcinoma of the colon as well as the rectum, and you're looking at the sites from most common to the least common. So the most common is going to be the rectum. So rectum is MC, that is most common, and this is about 38%. Next is the sigmoid colon. So there is sigmoid colon. So this sigmoid colon is about 21%. Then comes the presence of the cecum. The cecum amounts to about 12%. And then is the transverse ascending and the descending. So we're writing it as TAD. So transverse ascending and the descending colon. So this amounts to about 5.5, 5 and 4. So roughly around 5%. And next is the splenic flexure. Splenic flexure amounts to 3% and the hepatic flexure is about 2%. So now let's recap this. So first is the rectum, which is most common, it is about 38%. Next comes the sigmoid colon, about 21%. Next is the cecum with about 12%. Then is the TAD, transverse ascending descending. This is roughly around 5%. And then there is a splenic flexure for 3% and the hepatic flexure. This is for about 2%. To learn and grow daily like this, please do subscribe.